Access to health care is getting harder for some people who live in rural areas.
And during the pandemic, several clinics closed, forcing some people to drive a longer distance to get to doctors' offices and to hospitals. Fox 4's Alex Boyer joining us now with details on how state experts and also medical professionals are trying to address the problem. Alex.
Yeah, hi guys. You know, Texas is the fastest growing state in the country, adding 4 million people over the last decade. But as you mentioned, healthcare options in rural communities remain scarce. Many rural hospitals are closing, and then, of course, the pandemic has taken its own toll. As we pass the 2-year mark of the COVID-19 pandemic, a group of state medical experts shed light on what they call a healthcare crisis that continues to plague rural communities.
Even in the pre-pandemic era, Texas rural communities had difficulty accessing healthcare services because of travel time, limited healthcare providers, and high rates of underinsured and uninsured residents.
Despite the state's record growth, Texas ranks 42nd overall in health system performance, in large part because of how hard it is for rural residents to access health care they need. During the height of the pandemic, some rural hospitals had to close their ERs due to staffing limitations and bed shortages. In many cases, patients drive up to 2 hours to see a doctor.
If we lose a provider, as our practice is about to, that makes a significant difference in access to care.
Dr. Russell Thomas Jr. is a primary care physician in Eagle Lake, a southeast Texas town with a population of just over 3,000. He says telemedicine has helped some, but there are limitations to what it can do.
My patients are challenged to get in to see the specialists that they need.
According to the Texas Organization of Rural and Community Hospitals, there are 3 million rural Texans, about the population of the state of Arkansas. Still, 22 rural hospitals have closed over the past 5 years.
The last rural closure was in January of 20 in Bowie, Texas.
Part of the solution is to sponsor students from small communities who go to medical school and encourage them to come back and work where they grew up.
Homegrown is critically important. I'm from Eagle Lake, and that's where I'm practicing.
Financial incentives help, too.
I think the best tool probably is loan forgiveness programs for folks that choose to locate and serve in rural areas.
Yeah, and to that point, the hope is during the next state legislative session, there will be a surplus of fundings that will allow the state to restart what is called the Outstanding Rural Scholars, which provides a loan forgiveness for those medical providers who serve rural residents.